most efficacious agent out of all the agents that are available is levodopa. So ever since the drug actually was started to be used in the 1960s, one of the cornerstone drugs for the management of Parkinson's disease is levodopa. In fact, levodopa is considered the gold standard treatment, and the comparison of the other anti-Parkinsonian drugs is in relation to levodopa. Okay, the effectiveness. Now, a few points about levodopa. I'm sure most of you know that levodopa is a dopamine precursor, and this levodopa is usually administered in combination with a peripheral decarboxylase inhibitor to prevent its peripheral metabolism to dopamine and the development of nausea, vomiting, and orthostatic hypotension due to the activation of dopamine receptors in the area posterior, which are the nausea and vomiting centers, which are not protected by the blood-brain barrier. Okay, so levodopa, remember, is often given in combination with carbidopa. Levodopa plus carbidopa, which is a dopa decarboxylase inhibitor. Okay, right. Now, when you give the patient levodopa, this will benefit the classical motor features of Parkinson's disease, like tremor, rigidity, bradykinesia. But you should remember that the effect on tremor is not that great as like bradykinesia or rigidity. You will see some patients with Parkinson's disease having a benefit of tremor with levodopa, but you will also see certain patients in whom the tremor is not responding very well to levodopa. But bradykinesia and rigidity generally responds very well to levodopa. Okay. So levodopa will prolong the independence and employability and improves the quality of life and increases the lifespan. But in addition to the dopaminergic benefits, the levodopa is also useful for certain known motor features like anxiety, depression, and sweating, which can accompany Parkinson's disease. Now, when you start the patient on levodopa, the patient may develop certain acute dopaminergic side effects like nausea, vomiting, and orthostatic hypotension. Generally, these features are usually transient, and you can avoid these features by starting with lower doses of levodopa and then subsequent gradual uptitration. But if these features are persisting, like nausea, vomiting, orthostatic hypotension, if they persist, they can be treated with additional doses of carbidopa, that is, you are adding excess carbidopa, or you can administer this along with food. Generally, levodopa is not given along with food, but certain circumstances like this, you administer with food, or you add a peripheral dopamine receptor dopamine blocking agent like domperidone, which will not antagonize the central dopamine receptors. Another point to understand is that certain features like falling, freezing, autonomic dysfunction, and sleep disorders and dementia may emerge in the subsequent course of patients with Parkinson's disease, which may not actually respond very well to levodopa. Though these features are late features, but they can cause significant troubles in the later phases of Parkinson's disease.